name is Laura Nally, and I am a pediatric endocrinologist at Yale. Between college and medical school, I actually took a job with the National Housing Trust where I was helping Hurricane Katrina evacuees who had been displaced to Houston. We had 120 Hurricane Katrina evacuees who were living at the complex. They essentially hired me so I could help those folks reestablish their lives in Houston, since a lot of the families had come over and had lost their homes, had lost loved ones, and needed a lot of support. The interesting thing about it was, since I was deciding on a career in medicine, I learned so much about a lot of the disparities in medicine, the psychosocial barriers that can that are present today. I think now that I'm a physician, it just makes me realize each day when I'm seeing patients in the clinic, especially families who might qualify for like Medicaid or need extra help with their health insurance or financial needs, that, you know, it's harder than just coming to the clinic visits and doing what the doctor tells you, you know? I mean, like, they might not have a working car. They might not be able to pay for gas. They might be traveling from miles away. They may have had to miss work, and then they can't, you know, missing work for that day is gonna actually financially impact their family. And so I think it just gives me a much broader sense of all of the factors that are affecting the families that come into clinic who might need extra help. Folks who are in a lower socioeconomic class are not going to do as well in our healthcare system today. That is very well known pretty much across the spectrum of any illness that you could have. So, so I do believe that that's one of the important reasons why helping families have a stable home in a safe community where they can like go outside and, you know, play and have a normal childhood. They can live in a safer place, you know, they don't have to worry about going outside and, you know, what could happen to them. My experiences with the National Housing Trust did help me become a better physician overall, because I could better understand all of the different you know, difficulties that these families were facing. And so, you know, while doctors tend to think like, oh, okay, I need to figure out how to get you to, you know, make sure that your condition is controlled and stable, and I'm going to ask you to do like 10,000 things. If we don't think about all the other things that they're having to do on a daily basis just to like have a place to go home to, or have like, you know, food on the table to support their children, then we're not seeing the big picture. We're not understanding where they're coming from, and we're just asking them to, you know, we're just putting on like 30 other things on their plate when their plate's already full, and they're trying to accomplish so much, but they don't have the resources to do so.